Thank you very much. Thank you very much for inviting me and giving me the opportunity to very briefly review one component of the work that the CANDOUR team has been working on, the CANDOUR project that Mara introduced earlier. So this is one slice of what we're doing, and it very much builds on what Daniel just described about the importance of trying to figure out what messages work with the general public regarding vaccinations. And as Andrew Mark had pointed out, encouraging vaccinations is a very critical element of the solution to the current pandemic. The focus of this project that I'll talk about is vaccine uptake, the challenge of vaccine uptake. And in this particular study that I'm going to talk about, we focus very specifically on the United States. And we're currently developing an extension of the project for other parts of the world. But the impetus for this was the US. And as many of you realize, this graph from Our World in Data simply illustrates the bottom four countries in that chart of the US, Germany, and the UK are countries that started off reasonably well in terms of vaccine dosage administration, but that has leveled off and declined. And it's this decline that has triggered a concern, particularly in the United States, and particularly amongst the different US states, of a solution to promoting or aggressively increasing vaccination rates amongst the sort of hard to convince segments of the population. And what this has resulted in the U.S. states is a fairly eclectic mix of policies designed to encourage vaccinations. And these policies have ranged from, as the next slide will illustrate, lottery incentives have been a core message that the states have been employing to try to encourage increased vaccinations, and they're increasingly being employed by European countries, Poland, the reasoning behind this is that these policies will resonate with this hard to sort of convince segments of the population. Some of those people that Daniel was talking about. Many states in the US have also opted for monetary incentives rather than lotteries. And so there have been various incentive schemes that range between $100 and $200 being awarded either in cash or cash equivalents to individuals who get vaccinated. We're very interested in the CANDOUR project and trying to understand what motivates or works with respect to the vaccination decision. And as a result, we decided to implement a random controlled trial in the US that we believe would help us better understand, with what we consider to be well-designed research, what incentives, if any, actually help encourage individuals to vaccinate. We really don't have any experimental data, unlike the case with the actual development of vaccines. We don't have any experimental data that actually tells us much about whether lotteries work, whether cash incentives work, or whether neither works, right? And so that was the point of the vaccine uptake experiment that we implemented in the US. The experiment was pretty simple. It took 5 minutes. We randomly assigned 500 individuals to a basic 45-second CDC message. We randomly assigned 500 individuals to the same message, essentially, the first 30 seconds of that CDC message, video. The last 15 seconds highlighted the availability, possible availability of lotteries in their state. And then a third treatment was, again, the same basic 30-second CDC health message. The last 15 seconds of the video focused on the possible availability of cash incentives in some states in the US. So the idea here, the treatment is a very simple video treatment. The only thing that varies in the 3 different video treatments is the last 15 seconds. And individuals simply watch the 45-second video. The outcome variable here is very unobtrusive, and it was deliberately unobtrusive. We don't ask people whether they're going to go and get vaccinated. We simply, after they see the 45-second video, they're simply asked whether they would be interested in getting more information about vaccines in their state. I'll just briefly, if I do this correctly, this is one of the video treatments we used for the.
The U.S. is working hard to distribute the COVID-19 vaccines, free for everyone with no strings attached. COVID-19 vaccines are safe and effective. After you've been fully vaccinated, you can resume activities that you did prior to the pandemic. In some states, those who have had at least one COVID-19 vaccine shot will automatically be entered into a lottery. Some of these lotteries will pay winners over $1 million in cash. If you get vaccinated, you could get rewarded. If you're interested in more information about getting a COVID-19 vaccine shot in your state, please click on the link that will appear once this video ends.
That was the treatment. And the punchline is, which of these treatments work? Well, essentially, the lottery treatment, which is very pervasive in the US and in other countries, in fact, performed less well than a standard health message. And the treatment that actually worked, that proved to be the most positive relative to the control, the standard health treatment, was the cash message. So it seems, at least based on the US data, that if we're going to use incentives to try to encourage the hard to vaccinate to get vaccinated, we probably shouldn't be using lotteries, and we probably should be thinking about cash incentives if those are the choices that policymakers want to make. This is simply the odds ratio, which simply confirms that cash relative to the control was statistically significant, but the lottery was not. There is some interesting heterogeneity in these results, and the two that are particularly interesting is that, and this is relevant in the US case, the cash and lottery performed equally well for minority populations in the US. And the cash incentive, it turns out, performs particularly well for women compared to men. So our punchline here is that if we really want to understand what's going to generate or motivate people to get vaccinated, we need to think about random control trials. We should be thinking about unobtrusive measures of intentions or likely behavior. Obviously, ideally, we would like to know who actually got vaccinated and who did not get vaccinated as a result of these treatments, but that's challenging, although it's something that the CANDOUR team is exploring currently. And I'll just finish off by pointing out that this will become increasingly important in those countries that Andrew mentioned and Mark mentioned earlier, the African countries where the vaccination rates are extremely low, and actually where indifference about vaccination is very high. And a number of scholars and leaders in the African community have basically argued that we'll have to think about incentives as a means to get these populations enthusiastic about vaccinations. And that's the next stage of the CANDOUR project. We're currently taking this design and implementing it in the next couple of weeks in Uganda, and then we'll be implementing similar sort of efforts to sort of understand motivation in 20 other countries. So I will end on that. Thank you very much.